Hi, my name's Lee Matthews and I'm a physiotherapist, and I work here in the pain management team at Queen's Hospital. Today I wanted to guide you through some gentle exercises that you can do for your neck. It's normal when we've got long-term pain that we adapt how we do things and we move slightly differently, but over time that can actually lead to joint stiffness. It can lead to tightness of things like muscles, and by doing gentle stretches each day, it helps to lubricate the joints, it helps to ease things like joint stiffness, and it helps to reduce muscle spasm. So there's lots of reasons why it's good to move in a gentle way, and if you were keen to find out a bit more about the rationale behind that, if you click on the link above, I've recorded a video called A Rehabilitative Approach to Managing Long-Term Pain, and that gives you a bit more reasoning behind why we do it and how we'd go about progressing some of those things as well. So I'll guide you through some gentle stretches today. I'm going to be sat in a chair while we do these things. When I do these exercises, I'm aiming to work gently, so work within your own limits at home as well. And it's normal to feel some pops and creaks. You might well notice some irritability when you do that movement, and that's not a bad thing. I don't mind a little bit of discomfort as long as it's just a temporary thing as well. So I'll give you some guidance as we go through each of the stretches. I'll aim to do 2 of each stretch, holding for about 10 seconds. I'll always do an easier version of it, and if there are some progressions, I might show you those on the second time I do the stretch as well. So with all the movements that I'm going to guide you through, I'm going to be sat in a nice firm chair, and I want you to make sure that you've got a good start position. If you sit with a slouch and you try and do these movements, you're going to find that you're going to get less out of the exercise, you're going to encounter more barriers to moving, and it's actually more likely to provoke your symptoms. So if you sit up nice and tall, hopefully you'll get the most out of the exercises. So the first movement we're going to go through is neck rotation. So maybe start with the good side if you've got a good and a bad side, and I want you to try and look over the shoulder as far as you can. You might get some pops and creaks, you might encounter some discomfort with this movement, but again, just try and relax into the stretch, try not to tense up. Hold for about 10 seconds, and then back to the start position. And then whatever you've done to one side, let's do it to the other side. So here we go, sit up nice and tall, and then looking over the other shoulder. And again, if one side's more irritable than the other, you might even find that one side doesn't move as far, or it's more painful. And again, work with what's available to you. Nobody's perfectly symmetrical, so again, you just work with the stretches, and hopefully over time you'll find that you improve the movement there, or it becomes less irritable. And again, back over to that first side we looked over. So again, sit up tall, looking over your shoulder, hold for about 10 seconds, and then back to the middle. So that was neck rotation. For our next movement, we're going to do one called side flexion. So I'm going to bring my ear over towards my shoulder, and again, it might be that you go towards the side that feels most comfortable to begin with, and again, you work with what's right for you. On any given day, you might find that you actually do more with some of the stretches than the others on a good and a bad day, so make it fit your circumstances. So here we go. The easier version of the stretch is just to bring the ear down to the shoulder. And again, you're going to feel a big stretch from the earlobe all the way down into the shoulder there. Hold for about 10 seconds. And then back up again. And then the same to the other side. And again, hold for 10 seconds. And for some people, I actually even get them to just start off by doing these first 2 exercises laying down with their head on a pillow, just to offload it a little bit. So work with what's comfortable for you. The progression to this one of just doing the movement on its own would be to do the movement and then take a hand and pop it on top of your head there, maybe even applying a little bit of gentle resistance. And again, I would only progress if you're comfortable doing the other exercises and it's not been irritable at all. But again, you'll really feel that stretch between the earlobe and the shoulder. And then again, back over to the other side. So again, stick with the gentle stretch if that's right for you, but if you wanted a progression, then back to the start position. So that was neck side flexion. We're now going to do the movement which we call flexion, which is bringing the chin down to the chest. So we're going to start the movement from up high in the neck. I'm going to bring my chin down towards my chest bone, and then I'm also interested in what's going on in the upper back area as well. So the way we can involve that is by trying to curl up into a ball. So the easier thing would be to just do the movement on its own. And then slightly back up again. But the way we could increase the stretch there is by using our hands on top of our head. So here we go. I'm going to curl up into a ball and then add that extra stretch. Back to the start position. So our next movement is the movement of extension, which is looking up to the ceiling. If you find that you get giddiness when you look up, then again, stick with what the movement is available and right for you. So for some people, it might even be they just do the movement of looking up to the corner of where the wall meets the ceiling. If you're comfortable to do so though, you can look all the way up. I would say that it's often a lot easier if you've got a hand behind your neck to support you. And what you'll find as well is you can even lean into the back of the chair to get a stretch from the upper back area. So it might just be a small movement, but it could actually be leaning right into the back of the chair. And that's really going to be a stretch that you feel all the way down between your shoulder blades even. We hold for a few seconds. And then back up again, and then let's repeat the same thing again. So here we go, going back, and you could even have both hands behind your neck and then leaning back into the chair. And then back to the start position again. So our next movement we're going to do is one called chin retraction. It's a nice antidote to slouching with a poking chin posture. So many things that we do in our day involve slouching forwards over things like computers, when we're sat on the sofa watching TV. When we do things like drive, you often get this rounded shoulder posture, this poking chin. So what I'm looking for with a chin retraction is the opposite of that. So I'm sat back in the chair here, and I'm looking for that horizontal movement of just drawing the chin back as far as you can, really feeling that stretch. There's a temptation sometimes to either go down or up or to open the mouth, but I'd be encouraging you to just draw the chin straight backwards. And it's a bit like you're trying to show off a double chin here. You can even use your fingers to help facilitate the movement. And then relax. And again. This is also a really good exercise for encouraging the activity of these deep postural muscles. So with a lot of the other movements, I've just done 2 of them, and I'll just do a couple for the purpose of this video, but I actually do get people to do more of this chin retraction exercise. Sometimes I might get people to do somewhere between 5 and 10 repetitions, because it can actually help the postural muscles that support the neck to get a little bit stronger there. The next movement we're going to do is moving our attention down to the shoulders. So I want you to try and do some shoulder rolling for me. And again, you could just do a couple of these, but you might actually do 4 or 5 of them in a row. So all I'm looking to do, bring those shoulders forwards, up to the ceiling, right back behind you. So you're really trying to pinch between the shoulder blades, and then down to the floor. And again, out in front of you, up to the ceiling, out behind you like you're really pinching the shoulder blades together, and then down like you're trying to put those shoulder blades into your back pockets. So again, you might just do a few of those movements. And back down again, and that was shoulder rolling. There's a muscle that goes from the top of the neck all the way down into the shoulder blade called Levator Scapulae. It's another one that I'm interested in doing a stretch for. And the way we're going to go about that is I'm going to bring my chin down to the chest, and then from that position I'm going to bring my nose directly over the top of my pocket. Now that might be sufficient to feel the stretch, but what I'm now going to do, if it doesn't, is pop my hand over the top of the head and add a bit of stretch on there as well. So you should feel a stretch going from the top of your neck down into your shoulder blade. Hold it for about 10 seconds and then the same to the other side. So again, I'll bring my chin down, I rotate over so my nose is directly over where my pocket is, and I'm going to add a stretch on there. And then relax, and again, one more to each side. So chin down to the chest, over the pocket with your nose. Back up again, and one more time. And relax. And there you go. So that was 7 neck exercises that you can do that might help if you've got symptoms like pain or stiffness. Well, hopefully they were useful for you. Remember to work at the pace that's right for you. On a good day, you might find you can move a lot further with some of the movements than on a bad day. But even when you're going through a bad patch, it's still useful to do stretching. If you have a flare-up where the muscles are in tension, doing a little bit of gentle movement alongside things like heat and using medication can actually help to just relieve the symptoms so you recover quicker from the flare-up there. And remember, there's lots of different ways of making stretches easier or harder. At the most gentle level, we'll sometimes do these in laying, sometimes we'll do them in seated, and we can add extra stretch on there to get even more benefit there. But again, you've got to work at the level that's right for you. Exercise needs to be at the right grade, otherwise you can end up aggravating the symptoms rather than helping them. And even done each day, a couple of times a day, it could be several months before you really notice much difference there as well. So hang in there, do them gently, work at a pace that's right for you, and try and do them a couple of times a day. So if you were interested in some more exercises for things like stretches for office workers, if you were looking for stretches for your low back, I'll make sure there's some links that come up at the end of the video which will give you other options that you can explore. So thanks for watching, and we'll see you again soon.